This video provides information from the internet, and we do not promote any products or medicines. Always consult a doctor before using any medication. We are not responsible for any side effects or issues resulting from self-medication.
Dydrosure 10 tablet is a hormonal therapy designed to manage progesterone deficiency in women. It provides relief from various menstrual-related symptoms. Indications and uses. This medication is used to relieve menstrual pain, manage endometriosis and premenstrual syndrome symptoms, and support female reproductive health. It is also beneficial for postmenopausal women to address menopause symptoms when used with estrogens. How it works. The tablet helps manage issues associated with low progesterone levels by improving uterine lining thickness, which aids in regulating menstrual cycles and alleviating infertility. Directions for use. Take the tablet as directed by your physician. Swallow it whole with a glass of water without chewing or crushing. It can be taken with or without food. Consistency and timing is essential, so try to take it at the same time each day. Your doctor will determine the correct dosage based on your health condition and needs. Possible side effects. Common side effects include headaches, nausea, breast pain, and irregular periods. It is important to report any severe side effects to a healthcare provider. Precautions and warnings. Consult your doctor before using this medication if you have liver or kidney issues, depression, or are pregnant or breastfeeding. It is contraindicated in patients with certain tumors and those with a history of blood clots. FAQs. 1. What is Dydrosure 10 tablet used for? It is used for managing progesterone deficiency and related symptoms. 2. How should it be taken? Swallow it with water as prescribed, without chewing. 3. What are the side effects? Common side effects include headaches and nausea. 4. Can I stop taking it if I feel better? No, always consult your doctor before stopping any medication. Thank you for watching. If you have any questions or suggestions, please leave them in the comments below.